So here are some learning objectives, what you can do with your health administration focused MPA. Apply the advanced knowledge and skills for successful health administration practice. So it's the skills and knowledge that you need to go out there and do it. A lot of it is giving you confidence because you've learned these things in class, and then you apply it onto the job, and it'll give you what you need in order to be successful. You can lead contemporary public sector and healthcare industry units and organizations with this focused MPA. And you can apply the management and the healthcare administration theory to the professional practice of health administration. So it's a combination of the two that really provides you what you need to be successful. You'll engage in thoughtful and ethical professional practice as a leader in the healthcare industry, always very important. We believe our healthcare industry, attracts a special type of person, one who wants to help people. You don't have to be a clinician, you're still helping people by working in healthcare. And this idea that ethical treatment of people and patients, as well as applying to professionals, your employees, your doctors, it's a very big part of our program to make sure that you understand the professionalization and what's really important to be successful in our field. You engage in current and relevant policy creation and implementation through this program. So much new policy has been developed through Obamacare, but it's going to continue. It's not something that just happens once. Obamacare is being phased in over several years. And so you're going to see different policy changes, and you're going to be seeing some tweaking of policies depending on who gets elected next year, or the prospect of changes that could be occurring in the industry are still there. But we're going to give you the knowledge that you need in order to navigate through those waters no matter what's happening. Apply cooperative and collaborative practices across units and organizations. You can't work in a silo any longer. We in healthcare understand this. Teams are so very important, interdisciplinary teams. More than, when I was in school or when I was practicing as a hospital administrator, all different types of people have to come together with different specialty in order to do what's best for the patient. And it provides the administrator and the administrators that we need this opportunity to collaborate, to bring groups together in order to have team building and to get the most out of these teams, that people can use the synergy that's created by working in groups in order to perform better, in order to increase your organizational abilities to be successful. So our program will allow you to understand how these types of cooperative and collaborative practices come into play, and what you can do as a healthcare leader in order to be supportive of that. And to manage today's diverse and expanding public sector and healthcare industry workforce. Those of us that are in Los Angeles know the diversity here, but we're just the beginning of the nation, increasing in diversity throughout the rest of the nation. As I said before, through globalization, it's really the ability for us to work with all types of people. And our program will allow you this opportunity to explore how you can be more successful in dealing with a diverse workforce, but also a diverse patient population. Cultural competency is one of the skills that we will provide you in order to really make sure that you're doing what's best for the patient, depending on what their particular background is, so that you can excel at what we're doing, be basically very patient focused and centered, so that depending on where they're coming from, their background, their heritage, their religious orientation, we're going to be seeking out the healthcare treatments and medicines and provision of support that's going to match what they need for their culture. So our program is not just for a setting in one particular area that might have a population that's very homogeneous. It's to expand out to a great number of different people of different types. And this program, I think, is a good program in order to allow us to give you those kind of tools and techniques to be successful.
So what can I do with my Master's in Public Health, the MPH? Well, a lot of us can think back to times when you had that aha moment about your sort of career goals and what you wanted to do in the future. And a lot of times when you reflect back, it's probably when you were pretty young. For me, I lost my favorite aunt, who was very near and dear to me, to breast cancer when I was 12. And even before then, I had always been intrigued by medicine from a very young age. And so I had that interest, and I actually applied to medical school in the Caribbean. That's a whole other story that I'll have to tell you someday. But you can think back to that moment where you were touched by either a family member's health issue, your own health issue, others, or it may have been you started out thinking, yeah, I'd like to be a doctor or a nurse. But then, we call it sometimes, we kind of laugh because in public health, nobody says when they're 6 years old or 8 years old, I want to grow up to be a public health educator and public health, not like a firefighter or an astronaut or something, right? You kind of discover it. But then when you do and you realize it's so focused on prevention and touching people's lives, keeping the focus on, as I said before, people living longer, living healthier, and practicing lifestyle habits that will hopefully keep them healthy and alive and disease-free forever, it becomes very exciting, right? And you can think back to that time. Well, yeah, I remember when I first became intrigued in either allied health or medicine. And so what can you do with this degree? What do you actually do with it? And when we look at it versus an undergrad degree in public health, health education, that places you in a more coordinator role or more support role. But a master's in public health, get ready, because if you like to direct personnel, direct budgets, programs, grants and things, you're in the right area. So we will teach you with this program how to create, direct, and advocate for approaches, again, as I talked about before, that are focused on prevention, which is exciting. Many of our graduates go on to work in state public health departments, local health departments, national, the Centers for Disease Control. We've had interns go to the World Health Organization, and we'll talk more about that later. But again, focused on prevention and wellness. Conducting needs assessments, well, that kind of sounds a little dry, right? You're like, what? Anything involving a survey? But no, it's very exciting. There's so many innovative needs assessment techniques, like utilizing photo voice, taking pictures, taking audio records of people's experiences, and really getting into the qualitative and quantitative of what people experience in terms of their health and disease outcomes. Implementing and evaluating health-based programs. You will learn how to implement programs for positive behavior change. And they might be knowledge programs, they might be behavior programs, they might be refocusing somebody's attitude towards a more positive outlook on wellness. And it might be, looking at worksite wellness programs. You might be at a corporation where you're focused on prevention, or it might be they're actually out in the community in a grant-funded program. We have faith-based organizations now involved, community-based organizations. So you're implementing and evaluating, learning those skills on how to really evaluate those programs for their quality that they are. And then creating relevant communication materials. And this gets fun, guys, I'm telling you. Creating health education materials, and now it involves so much of social media, which you guys could teach me a thing or two. But looking at Facebook and Twitter, we're finding so many innovative ways to reach out to people, texting, in terms of delivering health education content. But you'll learn ways on how to create communication materials that are specific, that really reach people, that speak to people, whether it's a brochure in a doctor's office or if it's an actual website. You'd be learning how to create health-based communication materials, which is so important for what we do. And how to lead and execute programs, personnel, and budgets. There's the teams I talked about. And how do you really manage budgets effectively? How do you really manage personnel effectively? You'll be doing that in terms of funded grants out in the real world and working in public health departments, working as a part of either, if it's very programs-based or personnel-based, you need to have these skills that are essential, because as I said before, we're prepping you to be at that sort of director level when you go in. And applied epidemiological principles. We love that word, right? It's like the $500 word, epidemiology. How many syllables does it have? Okay, it's great. But that is the study of disease, mortality, morbidity, and those are fancy words of looking at disease trends or, actually causes of death trends. But why are they impacting certain areas and communities more than others? It's fascinating, and you can do detective works. When we look at food outbreaks, for example, food poisoning outbreaks in a certain location, we start to look at some of these numbers and epidemiological analysis for both chronic and infectious diseases. It's pretty exciting. Thanks,